can see we're going to talk about the Advanced Biological Concepts Hoof Supplement this evening, but at the same time, I feel that it's pertinent to discuss the anatomy of the foot and the hoof so that you can see what a supplement, what part of that foot the supplement is going to be fortifying for you. Some of these pictures, I have 2 or 3 that might be a little tough for some people to see. However, I think it's really helpful in seeing the anatomy of the hoof. Underneath that tough wall exterior is where you have the sensitive lamina, which is A indicated there. In between that is the hoof horn, or it's a tissue, as well as the lamina, part of the tissue structure that connects the hard exterior hoof wall with the laminate and the coffin bone. The hoof wall bears the weight of that horse, not essentially the sole or the bottom of the hoof. The exterior tough portion of that hoof wall does not contain any blood vessels or nerves. That's why it's maintained by a farrier. The consistency of that exterior structure is maintained of an insoluble protein called keratin, and is thus grown down from the coronary band. Various growth rates will be dependent upon the horse and several other factors. The hoof wall does have a natural protective coating to assist with sealing in the moisture. The hoof horn, which is beneath the wall, attaches to the sensitive lamina. Some of those tissues we will see a little bit later on in the webinar, and the coffin bone of the horse. The coronary band is at the top of the hoof, and that is the source of nutrition for the building of the exterior hoof wall. The sole is at the bottom of the hoof. That contains also the frog, or the back side of the sole, to the middle portion of the hoof. That particular area acts like a shock absorber. It also assists with blood circulation through the hoof, and we will discuss that also in slides later on. Keep in mind that the wall and the frog are the weight-bearing structures of the foot and not the sole. Now this is the hoof capsule, or the keratin membrane. This is the tough exterior of the hoof. Just to kind of give you an idea of what we're going to be looking at when we're discussing the nutritional aspect of this webinar. Inside the foot, we have L, which is the coffin bone. You have C, which is the sensitive lamina, and which is right here, and B, which is the insensitive lamina. These laminae actually will suspend the coffin bone to the exterior hoof wall, and it's those soft tissues that are managing the weight, or bearing the weight of the horse in all 4 of the feet. And you can see some other things listed there for the anatomy for your future reference. The nerve structure in the soft tissue here, very extensive, so you can see why laminitis can be a very, very painful experience for the horse. Blood circulation. Now this picture here, you can see that this blue vein coming down into the coronary band and into the hoof here, the soft tissues of the hoof. When I am working with clients that have horses with chronic laminitis, it is so crucial in learning how to palpate this digital pulse. Is what we're looking for when we palpate this, to monitor that regularly, to get just to establish what a norm is for your horse. Some horses may have a very slight pulse when they're not exhibiting symptoms of a hoof injury or trauma or laminitis, and in some horses you may not feel anything at all. But you need to establish that norm so that when the hoof is in some type of trauma, that when you feel this digital pulse, you will certainly feel a very strong throbbing, and in which case then you know that there's some stress occurring in the hoof at that particular time. You may also feel some heat on the hoof wall as well. So you might want to get with your veterinarian or your farrier to assist you in finding where you can on your horse, find that on the pastern or the joint above. This is the inside of the hoof where that keratin or that hoof capsule has been removed. The soft tissue here that is indicated by the arrow number 2 is the laminae, the sensitive laminae. You have the coronary band up at the top there, and then you have the heel bulb. At the bottom of the hoof, you can see that this is a soft, sensitive lamina with the blood supply being supplied to the bottom of the foot. A different picture, you can see that the laminae, indicated once again by the 2 figure and arrow, is tubular tissue, soft tissue that will string down, and this is the tissue that is adhesing the external hard wall to the coffin bone, which is underneath this soft tissue. You have the coronary band. In the second photograph, you have the coronary groove, and then you have insensitive lamina. It's a combination of a sensitive lamina and insensitive lamina, some other that will tie and bring the coffin bone in the hoof wall together. The coronary band has what's termed papillae. It is what supply nutrition to the hoof wall and plays a major part in the growth of that hoof. They also will produce a pigmented portion of the hoof wall. In other words, it's going to supply the color of the hoof. So either if you have a white color or a dark color to that hoof. The cavities that project down into the lamina here, you can see. In this other photograph, we're looking at the bottom of the sole corium, which is also covered by papillae that project into the tissue of the sole. That is also what will supply the nutrition and assist with the growth of the sole to the hoof. Now that's it for all the actual pictures. So you're good. If you've made it this far, we're good. Now we're going to talk about the hoof mechanism. Over here on the right, if you can see this dark penciled in area within the hoof, that is called the digital cushion. It is a mass of flexible material that does contribute to the formation of the heel of the horse, but is a primary shock absorber for the foot. So when weight is placed on that hoof, pressure will then be transmitted because of the weight of the horse through the phalanges, which is the bone structure, to the wall and to the digital cushion and the frog. The frog will generally make contact with the ground first, presses against the digital cushion, which will then flatten and force out the exterior edges or lateral edges, or I'm sorry, the lateral cartilages, which is the soft tissue in between the bony structures of the foot, and then will also press against the frog, which is flattened, and will push out the exterior bars or walls of the wall, the hoof wall. When the foot is lifted, the frog and the other flexible structures will return to its original position. Now when it comes to blood flow, which is very crucial for the foot, when the foot is placed on the ground, blood is forced from the foot into the leg, increasing pressure and by the change in the shape of the digital cushion in the frog. That pressure and change in shape will compress the vein structures in the foot, and when the foot is lifted, that compression will be relieved and blood flow will then resume back in the veins. It is this movement of the structure of the foot that acts as a pump. Exercise will increase blood circulation. It will favor hoof growth. When we have lack of exercise, extreme dryness to the exterior wall, and of course poor nutrition will inhibit all aspects of the foot. Now before I get into the nutritional portion of this webinar, there are a couple things I just really need to point out to you, that no individual single nutrient is key to a healthy foot. Also, good quality hooves are the result of good overall nutrition. Now, the horse's hooves, we've discussed, the exterior wall is made of keratin, and that is a complex sulfur-rich type protein. We know that it grows on a continual basis. and that same material will be found in the coat, mane, and tail of the horse. The keratin will arrange the cellular structure, will act like a bed spring, and it is that spring that acts as a natural cushioning effect. When it comes to the nutritional aspect of hoof growth and hoof quality, we're looking at components of the diet that will include protein, fats, carbohydrates, vitamins, and minerals, macro, as well as trace minerals. That rich protein portion of the exterior hoof is 95% protein. It may be, but very rarely do we have a protein deficiency that may be compromising the quality of our hoof. Two key amino acids that have been defined, if that is indeed the case, is lysine and methionine. Other major dietary components of the hoof are a list here of macro and trace elements. We have vitamins, and at the very end, essential fatty acids. We all are pretty much familiar with the numerous studies that have been done on the hoof care, replacement, and growth, and the most widely accepted supplements are those containing biotin and methionine. Now, we just talked a little bit about biotin. Biotin is a B vitamin, and like all the B vitamins, they are water soluble. So if there's an excess, they will be removed from the body, generally through the urine. Thus, they are not stored in the diet. Or in the body. They need to be supplied on a daily basis, either through the diet in various amounts or a supplement. Some of the B vitamins are produced in the natural bacteria in the large intestine. When that fiber is being broken down, a byproduct of that process is some B complex vitamins and some other vitamins. Now, if a horse is on a high grain diet, the production of biotin and some of those other vitamins are going to be inhibited, as well as the production of some of those fatty acids are going to be inhibited because of the acidity of the gut that tends to be there when we have a high grain type of diet. Horses are forage animals, and we maintain a horse on predominantly forage. It's going to be better off for the horse overall. The studies I was able to run across in the looking that I was able to find, supplementation of biotin seemed to make an improvement in a range of 15 to 60 milligrams per day. And as usual, like with any nutrient, they work hand in hand. I've talked about nutrition much like being like a wind chime. One element will affect another and need another, therefore, to become available to the body. So we know that methionine assists with the absorption of biotin. So if we have an excess of methionine, that will actually decrease absorption of some other important nutrients, so the copper and zinc, for instance. So if we incorporate methionine to the diet, we may lose assimilation or absorption of copper and zinc. Copper and zinc are very crucial, of course, to the immunity of the horse. If we're going to also supplement biotin in the horse's diet, the biotin will be used by the equine body in order of need. So if the horse is in poor health, the body will utilize the added biotin for connective tissue repair. So in other words, the joint structures, the soft tissue joint structures, biotin is utilized there. It will be used there first as opposed to being utilized through the hoof. So you obviously need to make an overall assessment of the horse prior to any supplementation so that you can monitor what kind of benefits you're seeing from this particular supplement and what kind of benefits you hope to see. Other nutrients that support hoof, the hoof growth and quality, the large amounts of sulfur containing, the hoof contains a large amount of sulfur containing amino acids. Two of those, one which we already discussed is methionine, the other is cysteine. Sulfur is also a component of the vitamins biotin and thiamine, both of those being one of the B vitamin group. Methionine is necessary for that keratin growth of the hoof wall exterior. There has been some research that a zinc deficiency will result in some of the defect of the horny material, or what they call the horn, which lies below that hoof wall that we discussed earlier. They have also discovered that zinc can have a reduced availability if we have a high calcium diet. You will see this quite often with processed foods, because they have a tendency to incorporate insoluble calcium that really doesn't need to be there. Now, when the body has that excess calcium floating around in the bloodstream, you can find that whenever we have an inflammation somewhere in the body or damage, that calcium may be deposited there, and thus far and move you into a realm of arthritic changes. Further discussion of calcium and phosphorus in the diet. Not only do we need to have those two in proper ratio, there have been trials also that said that confirmed that a diet adjustment to improve that ratio, or to get it where it needs to be for horses, you can see dramatic change in the appearance of the hoof horn in a relatively short period of time, 3 to 4 months. But that calcium-phosphorus ratio is so crucial for so many other aspects of the equine body. Now, the hoof quality will be determined by a lot of different things. Some of them you may have control of, some of them you may not. So there are breed and physical characteristics, the weather, of course, the quantity of the exercise, but a big one is hoof care routine and management. That foot needs to be checked regularly, and not only managed and picked out and monitored, more than just when the farrier comes out for a visit. The bedding and environment, genetics is one of those things that we just have to live with, but also faulty metabolism disease, certain drugs, and obviously a trauma will affect the hoof quality. And if you have a horse that is unfortunately dealing with chronic laminitis. The last link in the chain of obtaining a good quality foot for your horse is your farrier. Some of the things that you can do to assist your farrier to perform a really good job for your horse, which is so crucial, is to present a horse that is clean and has well-maintained feet. Provide a flat area in which the horse can be seen to walk, so they can look at the gait and make appropriate changes. You have to realize that the horse does have 4 feet, obviously, but each foot may be extremely different from the other. And so each foot is not going to be trimmed an exact same as the adjacent foot. Do not allow the horse's toes to become overgrown. Establish a rapport with your farrier. So crucial in kind of also journaling that information that you can retrieve from your farrier, and maintaining what is working best as far as angle and shoe and how long in between trimmings and those types of things that can help you, because certainly when you're working your horse, that hoof growth is going to grow at optimum through the summer and working seasons. When you extend into the winter months, the trimmings can move beyond the normal ranges that are utilized in the summertime. And if you have a lot of horses, it's kind of every horse is going to be a little bit different. So keeping that information for the farrier may be also assisting in the farrier as well. Some things to look for from your farrier. Obviously, we're going to want improved shape and balance of the foot for good forward ease and movement, less stress on joints, balancing that weight on all 4 feet, and not having that weight being bared on just 1 or 2 of the feet. So we need to look at that balance of that weight. If a shoe is used, make sure that the entire wall of the foot is fully protected. Nails should exit the wall at least 1 inch above the shoe. And the shoe size, you do not want to be too narrow as well. and they should not be pressing on the sole of that foot. And again, establishing a good rapport is so crucial. Now, when we're talking about advanced biologicals hoof supplement, there was a request of an assortment of farriers across the country to collect what they considered to be poor quality hoof trimmings and what they considered to be good quality hoof trimmings. Once those samples were collected, they were then ground down, and a nutritional analysis was run to indicate the differences in those. Obviously, those nutrients that were lacking in the poor quality hoof, we needed to have those be addressed in a hoof supplement. Trace elements certainly make a huge impact here, so we have in the hoof added them in several amino chelated forms for ease of assimilation. Now, so that we know that we've discovered earlier in the webinar that it's crucial for that biotin and other B vitamins to be formed or a byproduct of digestive processing. The ABCs Plus, if people are familiar with the ABCs Plus product, that's a digestive support product, and that's what we have used as our base for the hoof supplement. So there's an enzymatic profile, there's yeast, and I don't have listed here an herbal formula, herbal complex as well, and microorganisms that support digestion and breakdown of fiber, where these types of nutrients, vitamins, and fatty acids are produced, both of which are very crucial to good hoof quality and growth. The ABC Plus also assists with increase in digestibility of hay, and whenever we can break down natural food sources to obtain natural occurring nutrients that prior to the addition of a supplement, that is certainly going to be better for the horse. We've talked earlier about the biotin and methionine. Those have also been added into the ABC's hoof supplement. Not only do we want to have a fast growth if we're trying to help a horse with laminitis or some type of injury to the hoof capsule, then we want that hoof growth to be a good quality. So those have been added to support that. When we first were introducing the hoof supplement into some of our experimental horses, this was before and after photographs. This time frame was a period of 5 months. So to kind of give you an idea of repairing a hoof, it does take some time. They say anywhere from 6 to 1 year, 6 months to 1 year is certainly something to kind of wrap your mind around when you're trying to move forward as far as a hoof repairment is concerned. Now, the hoof supplement, the label, I believe, indicates that you will dose 1 to 2 scoops. 1 scoop would be 2 ounces. 2 scoops would be 4. Now, 2 ounces can be utilized to maintain a hoof. Some horses, I can even get by with 2 ounces to actually facilitate good quality hoof growth and management and good quality there. The 4 ounces I will definitely move up if dependent upon the quality of the hoof that we're going to be introducing the supplement to. So not only do we need to take into consideration the hoof itself, but the overall general health of the horse in order to get have the supplement work appropriately and to manage what we have intended. Now, the 8 ounces is something that I will use when I am in a situation, predominantly if there's an issue or if we have laminitis. And whenever you have the onset of laminitis, you need to have that diagnosed and treated expeditiously. So you do need to get your veterinarian involved as soon as possible. Once you are seeing symptomatic responses of the horse that could indicate laminitis, the disease has already progressed where you have some damage. So we need to get those managed right away. And this is where when you have chronic laminitis, or even if you see your horse limping up out of the pasture, palpating that digital pulse, checking the heat of that hoof wall exterior on a regular basis, you can get ahead of these things before there is tissue destruction. What has been studied at this point as far as what can induce laminitis is bacterial toxin insurgence, generally through the digestive system somehow or another. Also, the accumulation of proteolactic enzyme degradation, and that means that due to a body's normal natural response to toxins or fever or inflammation, cellular structures will be accumulated, and this enzyme will break down some of the tissue in the foot. Other species, like in humans, for instance, other organs will be damaged with the somewhat same response, but in horses, for some significant reason, it's the sensitive lamina, that tissue between the hoof wall and the coffin bone, that becomes targeted if the body is been inflamed or due to a systematic response or an immune response. And so then those toxins will leak from the vein and into the soft tissue, and then again begin to tear down that tissue, that lamina tissue. Also, if you have an inflammatory response, you're going to have reduced blood circulation to that tissue, and you will have less oxygen getting into those tissues, to maintain constructive force there to maintain the hoof as it is meant to be. So hopefully that can describe it to you. If you have further questions, you can give me a call. So this is Jeremy on the bottom here, and the reason Jeremy is here in this webinar is because it was through him that I was able to develop a nutritional protocol for laminitis. His initial bout of laminitis, I had a slight rotation, and at that particular time, it was many years ago, we had yet to be introduced to metabolic syndromes in horses, so insulin resistance. When I lost Jeremy, he was 22 years old. He was necropsied, and we did indeed find a tumor on the pituitary gland, so he was indeed in cushingoid horse, so we had to manage chronic laminitis every spring and every fall. He had a slightly, what I want to say here, crusty neck, but other than that, I did not see any other body. He would lose weight quite rapidly. So depending upon your horse's condition, when you're looking at an equine or a metabolic type horse, you're going to have a lot of things to take a look at here. So whenever I would check his digital pulse twice daily, always a little bit more concerned in the spring and fall, and I would increase the hoof up to 8 ounces. He was obviously maintained on the hoof supplement at the 4 ounces per day just because of his body condition and his size. So he was a really big horse. I used the hoof at 4 ounces for our maintenance, and then whenever I felt we were getting into some difficulty, I would increase that hoof to 8 ounces, and so he would receive 4 ounces in the AM and 4 ounces in the PM. The Joint Jolt is something I would also incorporate into the diet if we were dealing with a laminitis or founder. Founder is when we actually have a bone change in the foot, so that either the coffin bone will be rotated or it can actually sink down into the sole. In either case, you can see why it's extremely painful. So I was using the Joint Jolt to assist with circulation to the foot, but also as an alternative for pain management. Although once I was able to feel a throbbing in that digital pulse, I would, underneath veterinarian care, introduce bute for a maximum of 3 days, because it would take some time to get some of these nutritional aspects incorporated into the body to have effect. Also, I wanted to make sure that there was limited tissue damage because of reduced circulation to the foot. So even though Jeremy was on the Joint Jolt because of arthritic changes and because of his age, he was at a maintenance dose, and then I would increase the Joint Jolt if I knew we were getting into a situation of concern. He was on the free choice diagnostic system, like the majority of our horses are here for research. The free choice stress system would probably, if you have a horse with chronic or a high performance horse or a metabolic syndrome type horse, the free choice stress system would be indicated. Minimally, what I've discovered, that is with Hoof and with Rush Creek Mineral, you can establish and have a very sound and strong hoof. Now with Jeremy, we managed chronic laminitis for a period of 5 to 7 years, and then that time frame only once, and that was the initial introduction to laminitis that we had, that he was in significant pain and was unable to be exercised. Once we moved beyond that and established a good nutritional foundation and good veterinarian and farrier care, then I was able to ride Jeremy all the way up to his age of where he left us, which is about 22 years. So I never really, after that initial incident, have any further significant damage to that foot. So once again, the earlier that you can detect this disease to reduce laminae destruction, the better off you are, and further destruction of the hoof wall and movement of the coffin bone. Now, the mop I will utilize if we are looking at toxins being introduced into the bloodstream via the digestive tract. So if we have a horse that has been gotten into too much grain or has exceeded pasture time, and that's when we're going to top dress the mop into the diet. Or I can, because these horses are generally on a restricted diet afterwards, I can mix the mop with Probi and orally applicate it. The mop will help tie up some of those toxins in the digestive tract and reduce those being fed in through the bloodstream and down into the hoof area. So I know that this had a lot of information, but if you have any additional questions or you need further clarification, or that I know that each horse is a little bit different, you are more than welcome to give us a call at the office here. Other than that, Carrie?
Sandra, I do have, I have a couple of questions that came in, but I do think that you answered most of them throughout the presentation. The one question that we have, Sandy is asking, I have 2 horses that I let out every morning and bring in every night from the barn. The problem is the pasture. Right now it is very, very muddy, and to the point to where there is 6 inches of water and mud. Is this harmful for the horses to be in? They can get out of it, but it seems that they stand at the gate where it is the deepest.
Yeah, unfortunately that is the case, but yes, that type of environment can certainly break down the hoof quality. Not only that, it can lead to some fungal infections like scratches and things like that. So this may be where you're going to have to provide some pasture management and kind of fence off those areas, which I would do, because, and you could just take little electric fences that a lot of people use when they travel and kind of fence off those particular area, or divide your pasture up. Or you may have to develop a dry lot, which I ended up also doing for my horses, because there were seasons where the pasture was just too rich. I was not going to put, I already had a horse that was insulin resistant. I was managing his diet, and it was too risky to put him out on lush pasture. So he was on a dry lot until the pasture was reduced or it was burnt out, like in August in this particular area. So it may be, in order to maintain that hoof, which is so crucial to the horse, you may have to do some environment changes.
Okay. And one other question, actually this came in a couple different times, but could you go over a couple more, or some more of the signs of laminitis?
Well, I'll be honest, I didn't address that in my webinar, but so that's a really good question. You can, some of the more obvious symptoms would be, since the weight of the horse is predominantly, almost 60% of the horse's weight is placed on the front feet, you will see a horse that may be exhibiting early symptoms of laminitis roll back and place more of their weight on the rear feet. Also, if you put a halter and a lead on these horses and you attempt to walk them out or turn them in a tight corner or turn them in a turn that's relatively tight, you will see that there will be a reluctance to move at all. You can feel some heat in the hoof as well. Once you get the once you have the veterinarian out, they may do hoof testers on there to establish if there's some sensitivity, and those will apply some pressure to the hoof wall as well as the sole to find out if there's any sensitivity or pain or inflammation occurring in there. What else can you look for? I think those were probably, when I was working with laminitis, the two big ones of seeing the horse roll back onto, the weight of the horse to roll back onto the rear feet, and then also to see reluctance, severe reluctance to move when you ask that horse to walk.
Thank you, Kendra.